Good day and welcome to today's Dr. Anyoha's podcast. The last episode of my podcast, which was a couple of months ago, dealt with vaccination or immunization in children. And in that podcast, I share with you the vaccines that children receive from when they were born to when they go to college at about age 17, 18 or thereabout. And I promised to talk about symptoms and signs of some of the diseases that these vaccines prevent. So today we're going to be talking about symptoms and signs of some of the diseases that vaccination or immunization in children prevents. This is important because I usually encounter in my practice when parents want to know the kind of diseases prevented by the vaccination we give. What are these diseases and what do they cause? Because some of these diseases have been eradicated because of the vaccination. Today's parents do not understand or appreciate signs and symptoms of diseases that vaccination prevents. So let's talk about some of these diseases and their signs and symptoms. Number one, diphtheria. We're going to talk about pertussis and tetanus, and we're going to talk about Haemophilus influenza and pneumococcal. So let's talk about diphtheria. Diphtheria is a disease that when it occurs in infants and children produces inflammation of the windpipe. Because of inflammation of the windpipe and inflammation and enlargement of the glands, lymph nodes around the windpipe could be obstructed. When a windpipe is obstructed, infants and children are unable to breathe. When people are unable to breathe, they could go into respiratory arrest. So diphtheria causes inflammation around the windpipe and obstruction with breathing. This is some of the symptoms that diphtheria can cause, and the vaccination is to prevent this from occurring. This disease is passed through respiratory droplets from people who already have the disease. They can pass it into infants and children and adolescents, and the bacteria could end up in their throat, in their nostrils, and cause inflammation of the windpipe, obstructions of the windpipe, and inability to breathe. So the vaccination, in other words, prevents this from happening by giving people immunity against this bacteria. The same thing with pertussis. Pertussis is another disease condition that affects the upper airways or the respiratory windpipe. Symptoms usually present with cough. It can start with runny nose, cough, and difficulty in breathing. Again, this is because the location of involvement of this disease is in the windpipe, in the upper respiratory airways, which is necessary to get air from the nostrils into the lungs. So if the disease is attacking these upper airways and cause inflammation, it will block the airways and windpipe, and kids can breathe. They cannot breathe. They have this whooping cough, which could lead into stopping breathing, lack of oxygen, turning blue, and death if no intervention is available. The vaccination prevents these signs and symptoms of pertussis or whooping cough from happening. This is a respiratory-borne disease. In other words, it is passed on from one person to the other through respiratory droplets. If somebody with pertussis coughs into your face or around you, you could inhale that, and the bacteria would multiply in your nostrils, your pharynx, your throat, and causes inflammation and obstructions of the windpipe. Again, the vaccine helps these disease conditions from happening. Let's take a look at tetanus. In case of vaccination, students and new attendings, new doctors may not be able to see tetanus anymore, the signs and symptoms of tetanus, because the vaccine has pretty much eradicated tetanus. But I'm sure it is still very rampant in parts of Africa where vaccination is not a routine, or the so-called poor country, or resource-poor country. It causes spasms around the mouth and jaw and causes lockjaw. Somebody with tetanus might not be able to open their jaw because there is spasm of the muscles around the jaw. And it can cause severe generalized muscle spasms, which is very painful. Tetanus is transmitted usually from contamination of bodily wounds with human waste. And also during delivery and birth, if the umbilical cord is not properly taken care of, if there's poor hygiene around the umbilical cord, especially cotton and ligating the umbilical cord, it could be a source of tetanus. Babies and infants with tetanus are miserable. They won't be able to open their mouth because of spasms of the muscles around the jaw, and they can have generalized spasms. Vaccine is a useful way of preventing tetanus infection in humans, especially in infants and children. Now, what about Haemophilus influenza and the diseases it causes? This bacteria cause certain types of ear infections. It can cause pneumonia as well. This bacteria has a tendency to spread into the bloodstream and cause blood infections, bacteria in the blood system. It can also cause what we call epiglottitis, which is inflammation of the epiglottis, which is a small tissue in the throat, around the throat, which, if it's inflamed, would obstruct airway, obstruct people taking air into their lungs and into their respiratory system. So inflammation of this epiglottis could be a very serious problem. Because of the use of Haemophilus influenza type B vaccines, the incidence of epiglottitis has diminished, has almost gone away completely. I have not seen one in 20 years, thanks to the use of Haemophilus influenza type B vaccines. Receiving Haemophilus influenza type B vaccine prevents or reduces the occurrence of diseases which this bacteria cause. Some of the diseases we've already enumerated include epiglottitis, which is inflammation of epiglottis that is found in the throat, which, when it is inflamed, could cause obstruction of the windpipe and inability of a child to breathe. And if you can't breathe in it, you can suffer from respiratory arrest and you can turn blue because of lack of oxygen and you could die. So the vaccination prevents against this calamity, this catastrophe from happening. Should somebody contract Haemophilus influenza bacteria. Another vaccination that is frequently used, the pneumococcal vaccine, which is targeted towards pneumococcal pneumonia bacteria, helps prevent certain types of otitis media, which is ear infection, certain types of sinus infection, certain types of pneumonia as well, and abscesses in the lungs. So this is a very important vaccine that prevents against all these diseases. This pneumococcal bacteria, like Haemophilus influenza bacteria, likes to spread into the bloodstream, causing what we call bacteremia or septicemia, which is a bacteria in the blood system. And if it spreads in the blood, it could go to any part of the body and lodge there and cause more havoc. So that's why inoculating children against this bacteria is very, very important, especially children with sickle cell anemia. They are mostly vulnerable to this pneumococcal pneumonia infection. So let's talk about hepatitis B vaccine. Hepatitis is an infection that could affect the liver, and usually the manifestation of hepatitis B infection is jaundice. Somebody suddenly turns yellow, baby or child or infant or adolescent suddenly turns yellow. Yellow skin, yellow eyes. That is when you start suspecting that perhaps this child might have had or is suffering from hepatitis B infection. Nobody wants this because chronic hepatitis B infection over a long time can cause liver cancer and what we call fibrosis or cirrhosis of liver. Getting hepatitis B vaccine early in life, which is at birth and 2 months and 6 months after birth, which we discussed in the previous episode of this podcast, would prevent children from developing hepatitis B infection, which is infection that involves the liver and could cause liver cancer. Another infection of the liver is caused by hepatitis A infection. Both hepatitis A and hepatitis B are viral infections and both can affect the liver. But hepatitis A infection is not as devastating as hepatitis B infection, but it's still very dangerous for babies, children, young children, and some adolescents. And sometimes, even though sometimes people recover from this, but other times it could get worse and lead to liver damage, liver enlargement, swollen liver, a big liver, and sometimes it can lead to liver failure. So this is not a benign condition, even though it is more tolerable than hepatitis B. Now let's talk about chickenpox varicella. Varicella is still common. Sometimes we have sporadic outbreak of varicella, especially in the United States. But in poor countries or resource-poor country, the so-called poverty-stricken or underdeveloped country, varicella is still very common, and it can cause rash, itchy rash, fever, spread into the bloodstream, and it can also spread into the brain and spinal cord and lungs and lead to brain damage, or encephalitis, inflammation of the brain, and it can also cause pneumonia. So this is not a very benign problem. It could be devastating to certain kids. Immunizing children against varicella is still very, very important. Also, measles, Sometimes we also have outbreak of measles in United States and even some developed countries, but it's still common in underdeveloped countries. Causes fever, chills, fatigue, rash, fine rash, cough, and depending on the immune capacity of the child or depending on child's ability to fight back, this disease could be devastating to children and even lead to death. That's measles. Mumps infection is manifested by swollen glands, typically by swollen glands around the neck area, the jaw areas, and sometimes kind of involve swelling of the testicles in male and the ovaries in females. Rubella is another disease that could be prevented if a child were to get immunization against rubella. In rubella infection, if a pregnant woman doesn't have immunity against rubella and her baby contracts rubella through mom, the baby could suffer tremendously from disease caused by rubella that involves the organs such as liver, eyes, and spleen. And then the brain as well, or called congenital rubella syndrome, that present with severe rash, blueberry muffin rash. They can have hearing loss, they can have cataract, and they can have small head autism or autistic-like syndrome. These diseases are very real, and the vaccines help prevent them from happening. Nobody wants their infants, toddlers to develop measles, mumps, and rubella. So getting a vaccine to prevent that is very important. Talking about these signs and symptoms helps parents to think about the consequences of not immunizing their children against these diseases. Because for us who have practiced for a long time, who have seen these signs and symptoms, the threat is real. The risks are there for the children. So there's no reason why parents should take chance and not immunize their kids against these diseases. Before vaccines are routinely used, we used to have cases of rubella, measles, mumps, tetanus, pertussis, diphtheria, hepatitis B, hepatitis A, and so on and so forth. You don't want your child to be the one to contract these diseases and suffer their signs and symptoms. Moving on to meningitis. Meningitis is a disease that affects the brain and the spinal cord and causes neck stiffness and causes lethargy and can cause loss of consciousness. Again, this is real, and the meningitis shots would help prevent some cases of meningitis. At least you rest assured that your child's risk of getting meningitis is diminished when you allow them to get these vaccines, especially the meningitis vaccines. And then, of course, we have the HPV vaccine, which is called the human papillomavirus. That prevents cancer around the cervix. Cervix is part of the uterus, part of the womb. And, of course, it prevents cancer around the neck and head regions, around the throat, the pharynx, and the head and neck regions. Nobody wants their kids to have these diseases. And this is why immunizing them against these potentially devastating diseases is very, very important. Finally, the rotavirus is also one of the commonly used vaccines, especially in kids below the age of 6 months. They're given at 2 months, 4 months, and 6 months. The one I use in my office is called Rotatec. So it's given at age 2 months, 4 months, and 6 months. It prevents against certain diarrhea caused by rotavirus infection. Symptoms include diarrhea, profuse diarrhea, fever, lethargy, especially when a child or infant loses a lot of fluid. And fortunately, this is given through the mouth, and the baby suck on it, and it prevents them from certain types of diarrhea caused by rotavirus. So there's no reason why parents should not allow their babies to get rotavirus vaccines. Not doing so might result in profuse diarrhea, which will lead to dehydration, lethargy, and probably admission into hospital for IV fluid. We don't see these diseases commonly as we saw them in the past. The reason why we don't see them commonly is because effectiveness, the efficacy of the vaccines used. So in summary, I've enumerated some of the signs and symptoms of diseases that are prevented by routine immunizations. Usually, I briefly go through this with parents that bring their newborns to my office. The vaccination we're giving is more or less to prevent or diminish the severity of this infection should they occur. So thank you so much for listening. And again, share this information with your friends and families. Thank you.